Acholi and Karamoja regions have suffered constant lack of proper service delivery in the past many decades. This has left several communities desperate and unable to access appropriate health services whenever they needed it. For this reason, UNICEF, in partnership with Korean International Cooperation Agency KOICA, extended their support to these marginalized regions and communities to be able to access appropriate health services, targeting pregnant mothers, their newly born babies, and children who are the most vulnerable. Kalongo is one of the few hospitals in the Acholi region that meets the requirements of a health facility by UNICEF's and Uganda's Ministry of Health standards.
Before this project came in to support us in the district here, we were having even maternal death, even neonatal death was high, because they come sometimes when the fetal height is very low, even below 80, and we try to resuscitate. Sometimes we fail, sometimes we succeed. Just because of late referral, that some mothers were referred late from the low earth unit to the hospital. Now they are referred early, even during day or night. The boarders who are trained, they bring these mothers. Even if it is raining, they are so committed. They bring the mothers and we are able to serve them as quick as possible and their life is safe. This training I attended in Kiku, and how I benefited is like managing obstetrical emergency mostly. That because I'm also a mentor and in charge, it is helping me to mentor the students how to manage obstetrical emergency.
Health workers like midwives have been able to provide their clients with appropriate knowledge and useful information on their situation whenever they sought medical services. Rebecca is one of the midwives UNICEF trained.
Actually, the training has really helped me. I've really improved on my quality services which I'm providing here, because I've learned a lot in handling emergencies. Like some mothers come to the facility, you'll find you take her BP is very high. At least now I can be able to manage that mother, and then I refer the mother in case needs a referral to the hospital. And we are working hand in hand with the VHTs. VHTs, they are helping us in the communities to do sensitization, identifying high-risk mothers and other children with problems, and they refer them to the hospital.
Because of their broad influence on communities, religious leaders have also been involved and trained to support the program.
I encourage even the men, even the other women. You tell your husband that on such and such a day, you should go to the hospital for attaining the antenatal care. And you need to start it earlier.
UNICEF has been at the helm of meeting the health needs of pregnant mothers and their newborn babies in these marginalized communities, thanks to the support of Korean International Cooperation Agency, KOICA.
Our progress in the reduction of maternal mortality and neonatal mortality has been low, very, very slow. For 10 years, we were not able to achieve the Millennium Development Goal. So this project is now pushing us to the last mile, and reaching the last mile requires a lot of resources, both human, material, financial. We have built the capacity of the health workers to manage emergency, as well as emergency obstetric care, as well as comprehensive emergency care, and as well as resuscitating of babies who might have birth asphyxia or who might fail to breathe at birth. They are able to resuscitate these babies. And all these factors have led to reduction in maternal and newborn death in the health facilities. We have also observed that significant increase in deliveries in health facilities. We have significantly reduced neonatal death. Before the project, we were 33. Now, according to the statistics that we have collected from these 3 districts, we are coming to 25%.